Hi everyone, very good evening guys. I hope I'm audible and visible to all of you. A quick confirmation please. There's a chat box available. If you could give me a thumbs up or a good, an okay if the audio video is working fine. And if yes, then we'll begin without any further delay. And till the time all the students are joining in, I think I can give everyone an update regarding the Unacademy offer that is going on, which has been extended up till 29th of July, that is tomorrow. And the code that would help you in subscribing to the same would be PATHO10. So that is giving you an extra 20% discount on the following batches. There is an INI-CET batch that has started. There's also a very unique batch that is starting from August 4th, and that is a doubt clarification batch. So one class per subject will be dedicated for doubt clarification, which would be live and will cater to all the doubts that the students have, whether NEET, INI-CET or FMGE. Apart from that, there's also a TND batch for droppers that has started. I have already completed the pathology classes under it. I just finished them last week. So in case you wish to join in, they are still ongoing for all the subjects. Pathology is already over. So yes, in case you wish to avail, then you can definitely use the current ongoing offer, which is available till tomorrow. Okay, so I guess most of you have joined in. As I can see, what is the plan for today? It's a very quick, rapid kind of a class where we are going to talk about image spotters, right? So we have certain images. It's not MCQ. I've not got any poll or anything. So primarily images that we are going to deal with. So I think that is going to help all of us in the exam. There are random 20 images which I'm not going to give you any history of. And there we begin with spotter number 1. So everyone needs to type out whatever you feel the answer is. And I'll be giving you like 10 to 15 seconds to think before I spill the beans and I tell you the answer. So okay, so I can see the first answer coming my way, and I hope everyone will agree with this. Yes, this is a classical and a must-know image in pathology, that is from amyloid. Now, when I'm talking about amyloid, what stain has been used over here? The stain used over here is the Congo red stain, right? What are the questions on Congo red that I get? So if I'm saying this is Congo red, what color has it given to amyloid? So when we see the color given to amyloid, it is the apple green color. So we have a very characteristic apple green color that will be given to amyloid. And I can see that golden, green, apple green kind of color. And which microscopy are we dealing with? Answers which I've already got from students. We are dealing with polarizing microscopy, right? So these are the questions that you get. Amyloid is stained with what? It is stained with Congo red. It gives an apple green birefringence, and I use polarizing microscopy. How else can this question come? And also at any point of time, if you feel that I'm going faster than usual, because these are photos, right? You can always let me know. We can lower the pace. If all's well, then I hope we can move at the same pace. If I say this is a biopsy from the thyroid, then which is the tumor that we would be thinking of? Thyroid and amyloid. There's only one tumor coming to our mind because this biopsy was actually from the thyroid only. So which thyroid tumor shows you amyloid? The thyroid tumor is medullary carcinoma thyroid. Perfect. So if I ask you the next question, students who have read the course earlier, medullary carcinoma thyroid shows you which kind of amyloid? What is the name of the amyloid that it shows you? And the answer to that is ACAL. The kind of amyloid shown by medullary carcinoma thyroid is ACAL. What does CAL stand for? CAL particularly stands for calcitonin. Calcitonin is the main tumor marker, right? For medullary carcinoma, it's the tumor marker. So ACAL becomes the amyloid. I think nothing more in this image that I have to teach you. So we'll move on to spotter number 2. I'll give you 15 seconds to give me an answer to this. Spotter number 2. If no one gives me an answer, then I'll be giving you the organ. But I guess we will get an answer. I'm positive about it. So there is some cyst, multiple cysts that are present. If you want a history, this is an ovarian tumor. When we say ovarian tumor, okay, so some of you thought it was liver. Liver will not have this pearly white kind of a color, right? Liver is a little brownish. So, okay, some of you say hydated cyst. Hydated cyst, but where? You're only saying cyst. I'm saying the organ is ovary. Ovary showing you a hydrated cyst, obviously nahi banta. Oh, hydrated cyst would have been somewhere in liver or lungs. In the ovary, yes, very good. Okay, one more. Wrong answer kya tha? Dermoid. Some of you said dermoid. Dermoid is teratoma. Teratoma will show me hair and skin and teeth and bone and all of that. So this is not a dermoid cyst. Now I've started getting a right answer. This is a mucinous cyst adenoma. This is a mucinous tumor of the ovary. So first and foremost, you'll say, how did you identify the cyst? Can you all see these empty spaces? These empty spaces are all the cysts. So cysts are there, and how many cysts? I can see one over here, one over here. So few tiny ones over here. These are not single cysts. They are multiple cysts. So how do I get to know it is a, so what are the other types of cyst adenomas? If I give you a, if I give you a comparison, you will say, ma'am, in the ovary, there is something known as the serous ovarian tumors or serous cyst adenoma. And the other one is known as mucinous cyst adenoma. And if you want to compare between these two, you first look at the number of the cysts. So see, serous will have single. It will have a single cyst, or you call it uniloculated cyst. Whereas mucinous cyst adenoma, M for M, will have multiloculated. Multiple cysts are going to be present. So when I come back to my question, I see multiple cysts over here, not single. I see multiple cysts. So first pointing towards mucinous cyst adenoma is multiloculation. Then you'll say, why did you label them? Why did you call them serous versus mucinous? Because the fluid. What kind of fluid is going to be present inside them? So serous, the word serous refers to water. It has complete watery fluid inside it. Whereas the word mucin refers to gel. So there is a kind of a jelly or a mucinous material present inside it. So over here, obviously, I can't see any water. I can't see any gel because the ovary has been cut, right? So water will flow out, gel will flow out. Here I can only see the number of the cysts, and on the number of the cysts, I feel it is a mucinous cyst adenoma. Okay, one thing that is common, be it a serous cyst adenoma or be it a mucinous cyst adenoma, can you tell me the tumor marker that works well for both? Any kind of ovarian surface tumor, the tumor marker, I've already got an answer to that, CA125. Whether serous or ovarian, it is going to be CA125, that is going to be elevated. Okay, having said that, let's move on to spotter number 3. I think this ended up being the way the AIMS questions were coming. They likha bhi hai. So it becomes, identification becomes very, very simple. Spotter number 3, and again this is an ovarian tumor. Obviously everyone can see what is written, so some of you still say seminoma, but that's what I'm wanting to train you towards. Anyone who's given previous year exam papers will know that there have been so many questions in the past where the examiner has actually written some details in the image itself. So even if you're vigilant and you're alert in the exam, that also counts for a lot of things, and this is just one of those things. This is a case of dysgerminoma, another ovarian tumor. So how did I identify this? So when I look at this particular tumor, we call it the potato cut appearance. It looks as if there's a potato which has been cut. So this has a classical potato cut appearance. And when I look at it under the microscope, see, if I show you every cell, do you agree there's a little whitish touch to every cell? Every cell has a little bit of whitish color. What are the colors in pathology? The two colors of pathology are pink and blue. I always say pathology is pink and blue, but suddenly over here, I'm seeing that the cells are giving a very whitish appearance because dysgerminoma shows you the presence of clear cells, which many of you know as fried egg appearance. It's a very famous term called fried egg appearance. Any reason? Can anyone tell me clear cells, why are they white? Why are they clear? What do they contain? That's a potential question for your future exams. Why are the cells of seminoma and dysgerminoma clear? Because they contain glycogen. Because they contain perfect glycogen. So now that you've told me up till here, you will also tell me what is the special stain for glycogen that is going to help us. The special stain for glycogen is going to be PAS. I hope everyone remembers that the special stain for glycogen is going to be glycogen is PAS positive. So I can see khali clear cells, and then suddenly there's this area Where I see too many blue, if you look carefully, there's a blue color dot 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 kind of appearance. What is this blue color dot 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 appearance? Lots and lots of lymphocytes and plasma cells. That is something very characteristic of this particular tumor. It will show you numerous lymphocytes and numerous plasma cells. So let's repeat. When I'm dealing with dysgerminoma, the gross appearance is a potato cut appearance. Microscopically, we get clear cells of fried egg appearance. Why? Because they contain glycogen. And which are the inflammatory cells that you see in abundance? Lymphocytes and plasma cells. I hope that is clear, because I can move on to spotter number 4. But before that, all the students who are planning to go in and write INI-CET, I want to ask you that whether you are dealing with seminoma in the testis or you are dealing with dysgerminoma in the ovary, can you tell me a list of all the markers, the new markers that are positive? All the new markers, because this will help you in your INI-CET exam a lot. And there's a very famous mnemonic that I teach you guys. That mnemonic is 1, 2, 3, 4, 5. What is that mnemonic? 1, 2, 3, 4, 5. So when we are having the new markers, 1 se yaad aayega CD117. CD117. 2 se yaad aayega D240. It is CD117 positive. It is D240 positive. From 3 you will remember OCT34. It is OCT34 positive. From 4 you will remember SAL4. It is SAL4 positive. And from 5 you will remember 5 alphabets. NaNOG positive. Let's do a recap. From 1 it is CD117. With 2 it is D240. With 3 and 4 it is OCT34. With 4 it is SAL4, and with 5 there is NaNOG. These are all the new markers. If you remember 1, 2, 3, 4, 5, you'll always remember. These are the new markers for seminoma and dysgerminoma. I hope that's okay. We can move on to spotter 4. Very, very characteristic. And this came in the INI-CET and NEET both. Even in the FMGE exam. Har exam mein photo aata hai. Spotter number 4. Hint needed, then hint is ovarian tumor. Again, hint is ovarian tumor. Okay, so most of you have got it right. As soon as I say ovarian tumor, your answer is, ma'am, this is a yolk sac tumor. Why do I call it yolk sac tumor? Because this entire appearance that I'm seeing over here is known as a Schiller dual body. What's the other name, guys? What's the other name of a Schiller dual body? It is also known as a glomeruloid body. These are the two names that have been given to it. Either of the two will be there in the paper. So everyone please learn it up. Either it is called a Schiller dual body or it is referred to as a glomeruloid body seen in yolk sac tumor. So how did I identify? For those who are not aware, how do you identify a Schiller dual body? First, draw with me. The drawing is that first you will see a blood vessel. You will see a blood vessel in the center. That's why you call it glomeruloid, because everyone knows that glomerulus has a lot of blood vessels, capillaries. So you will see a blood vessel. Yes, then you will see 2 rows of cells. This is tumor cell ka row number 1. These are tumor cells. And there is a tumor cell column number 2. So these are these 2 circles of tumor cells that you are seeing with a gap between the 2. There is going to be a space between the 2. This is also tumor cell. And this is also tumor cell. So simple. In the center you'll have a blood vessel. Then you'll have 2 rows of tumor cells with a space in between. Let's find it out over here. See, in the center you have red color. You have a blood vessel. Then you have 1 row of tumor cells out here. You have this 1 row of tumor cells out here, blue color cells. And you have 1 row of tumor cells out here. And can everyone see? There is a space in between. So blood vessel, tumor, space, tumor. Last question, easiest one. This is for second year students. What is the tumor marker? What is the tumor marker of yolk sac tumor? Tumor marker of yolk sac tumor, alpha fetoprotein. Second year students के लिए था. But all the NEET PG, post interns, exam going students tell me, other than alpha fetoprotein, what is the tumor marker? Other than AFP, there's one more, and that is alpha-1 antitrypsin. This has come in the FMG exam also. What are the 2 tumor markers of yolk sac tumor? Alpha fetoprotein and alpha-1 antitrypsin. Okay, coming to the next one. So I guess we're done with spotter 4. Let's come down to spotter 5. Answer. I'm not giving you a history because I want you to think. I want you to identify first. History is always available. So no answers up till now. Okay, one answer I've got. Indian file patterns. So without history, without organ also, students are identifying. This means pathology has finally started making some sense to us, right? So we are talking about a breast tumor. Yes, we are talking about a breast tumor. And when we talk about breast tumor, this one picture is characteristic. How are the cells present? One behind the other. One behind the other. That is how tumor cells are there. Look, as if they're standing in a line. Blue color cells, they are all in a line. Over here also, the blue color cells are all in a line. This is known as the Indian file pattern. This is referred to as Indian file pattern. Why Indian file? They want to denote the Indian army. Like in the Indian army, everyone is very disciplined and they are standing in a straight line, one behind the other. Same way, Indian file pattern, the tumor cells are in a line, one behind the other, and that is indicative of invasive lobular carcinoma breast. Invasive lobular carcinoma shows you Indian file pattern, and I think everyone has given me a correct answer. What is the mutation that you see in this particular case? So invasive lobular carcinoma shows you loss of E-cadherin. Loss of E-cadherin is a question that is very important for every exam. ILC, two things. Number one, Indian file pattern. Number two, loss of E-cadherin. Amazing. Okay, spotter number 5 done. Spotter number 6 is first a clinical picture, and then we'll go on to the corresponding pathology picture. So what is this? This is the colposcopic view. This is the cervix that is being seen, and as soon as we see the cervix, I can see that there is what? Okay, everyone started giving answer. You call it candida. Why did you call it candida? Because the kind of discharge is the curdy white discharge. The kind of discharge that you see is a curdy white discharge. So as soon as you see this curdy white discharge, coming to everyone's mind is candida, right? And Dr. Vikas, thank you for this. Amidst all the answers, a comment of appreciation. Thank you so much. It genuinely means a lot. Okay, so having said that, candida, अब इसको microscopically देखो. Microscopically क्या दिखेगा? When I take a biopsy or I take a pap smear from here, what is going to happen? What effect? Any appearance? Come on guys, you know it. Candida pap smear पे क्या show करेगा? One answer and I'll start the explanation. What will it show? Shish kebab. Very good. So when we see candida on a pap smear, we end up seeing the shish kebab effect. I'm very sorry for teaching you this during dinner time, but unfortunately I'm going to ruin this for a lot of you. Whosoever is fond of kebabs probably would not be after reading this. So why does candida show you shish kebab effect? So does everyone remember candida shows you pseudo hyphae? Candida shows you the pseudo hyphae. Fungus hai, to yes, obviously I understand it will show me pseudo hyphae. So in the center, what will I see? I will see the presence of pseudo hyphae. If you look carefully, there's a line. See very carefully with me, there's a line going through. Through and through, there are pseudo hyphae present. So that is the stick on which all the kebabs are placed, the stew, the stick, that is the pseudo hyphae. On top of that, you will have to place the pieces of kebab. Okay, what are these pieces of kebab? These are the cells of the cervix. These are the epithelial cells of the cervix. So these are the pieces of kebab, and that is the stick. I'll show you one more picture. See, there is a stick or the pseudo hyphae going through and through. All these epithelial cells are on top of it. So like I said, I've kind of ruined it, but that's how it is. That shish kebab effect, this very tasty food item, is seen in what? It is seen in candidal infection. And how will the patient present? Grossly, patient is going to present as a clinical picture of a curdy white discharge. All good. Spotter number 6 is done. Let's move on to spotter number 7. What is this classical appearance known as? Primarily for the second years. What is this classical picture known as? Okay, so one answer awaited. 10 seconds. Excellent. You say, ma'am, this is a motility. What motility? This is a swarming motility. So what do we mean? Some people call it swarming growth and some people call it swarming motility. And what's the reason for this swarming motility? See, this is the organism which is growing. Then the blank area is the resting phase. then again the organism is growing, then the resting phase, then again the organism is growing. So there are concentric circles. There are concentric circles in which it is moving, swarming motility. What all organisms show us swarming motility? So this is obviously a blood agar, reddish color. So obviously it's a blood agar, and we have to remember the mnemonic PVCs. So Proteus shows us the presence of swarming. Vibrio, not all Vibrio parahemolyticus shows us the presence of swarming. Clostridium tetani and Serratia. Repeating, Proteus, Vibrio parahemolyticus, Clostridium tetani and Serratia. PVCs show us the presence of swarming motility, hence prove that swarming is not a specific finding. Only finding swarming does not indicate any one organism. So now if I ask you that, okay, this agar was what? Reddish color. This was a blood agar, right? So fine, I'm using that, but I don't want the organism to keep on moving like that. I want to study the organism. I want to take a culture. I want to grow it further. So I don't want it should keep on moving. How do I stop swarming? How do I inhibit swarming? You will say, ma'am, add something to this blood agar. Add something to this blood agar that will not let the organism move. And one very common thing added to blood agar are the bile salts. I think everyone knows. If you add chemicals, if you add bile salts, then the swarming will not occur. That is number one. Number two is, when blood agar is prepared, regular normal blood agar is prepared, we prepare it at a concentration of 2% agar. That is the usual protocol in microbiology. We prepare it at a 2% agar. If I make it at a 6% agar, do you agree it will concentration बढ़ा दिया? It will become very, very firm. If I make it as a firm agar, or I make it at a concentration of 6% agar, the organism will not be allowed to move because the agar has become very firm. No one can move inside it. So either you add some chemicals, then the swarming will not occur, or you make the agar very, very rich with 6%, then also swarming will not occur. So PVCs is the mnemonic. I hope spotter number 7 is also sorted. Let's move on. Spotter 8. Spotter 8, another culture media and a very, very important one. Okay, so a very, very important question, I suppose, which comes in many, many exams. McConkey agar. Yes, this is definitely a McConkey agar. Tell me the utility. When in microbiology will I use a McConkey agar? When I want to find out that an organism is a lactose fermenter or is a non-lactose fermenter. When I want to do the differentiation between a lactose fermenter versus a non-lactose fermenter, I use a McConkey agar and it's in front of you. Lactose fermenter is giving what color? Lactose fermentation is giving a pink color, whereas non-lactose fermenter is giving a very pale color. So just remember that lactose fermentation is going to give us a pinkish color. That is the utility of McConkey agar. So this area, whatever was grown in this area is a lactose fermenter. What is the composition? This is another question. What is McConkey agar made up of? McConkey agar is made up of plant. That is the main mnemonic that you guys have to learn. So सबसे पहले you will say, ma'am, it's McConkey agar. So A obviously means agar. Obvious situation. Every agar is always mixed with peptone. That's the usual of any kind of agar. So P is very obvious, it's peptone. A is very obvious that it's agar. What am I trying to test? I am trying to test for lactose. So I have to add lactose in the medium. I have to add lactose. So these three are obvious. Peptone hoga, lactose hoga, agar hoga. Then I'm talking about color change. Is the color changing to red? Is it becoming pale? So I need an indicator. What is the indicator that we have used? The indicator is N for neutral red. Yes, and I see a lot of right answers coming our way. The indicator is neutral red. This is a question in the previous years. In McConkey agar, what is the indicator used? It is neutral red. And finally, what is with T? I say taurocolate. What is taurocolate? Like I say sodium taurocolate. What is taurocolate? It is a bile salt. So now tell me, if taurocolate is a bile salt, McConkey agar has bile salts. Does McConkey agar allow swarming? What is your interpretation? Will McConkey agar allow swarming? It will not. Why does it not allow swarming? It doesn't allow that round and round motility to occur. Why? Because it contains bile salts, chemicals. So let's repeat: peptone, lactose, agar, neutral red, and sodium taurocolate. Okay, because this was spotter 8, I have to continue it with spotter 9. What is this? What is this? A very important one. Okay, waiting for some answers. CLED, perfect. Like I said, because we were talking about one lactose medium, I have to talk about the other lactose medium also, and that is going to be CLED. So, if I tell you, you don't need to know the full form, but if I tell you the full form, it is cysteine lactose electrolyte deficient. So, I can see cysteine lactose electrolyte deficient. Lactose is again present over here, means I want to differentiate whether something is a lactose fermenter or not. Here, what color has lactose fermentation given us? On lactose fermentation, we've got a yellow color. So please, if I ask you the differences, between these two lactose fermentation, I think all of you can help me with the differences. So let's start number 1 with McConkey agar. Tell me, in McConkey agar, lactose fermentation was giving what color? McConkey agar, lactose fermentation was giving a pink color. Whereas when I'm talking about CLED media, lactose fermentation is giving a yellow color. Next, if I ask you what was the color indicator in McConkey agar? The color indicator in McConkey agar was N, neutral red. It was neutral red. You will ask me, ma'am, what is the color indicator in CLED? If you see the background color is all blue. So basically it contains bromothymol blue. This is also a previous year question. CLED contains BTB. CLED contains BTB, bromothymol blue, as one of the indicators. This will change the color to yellow, and neutral red will change the color to pink over here. That is how you will get to know about lactose fermentation. Next question, and this question has come in AIMS, it has come in NEET, it has come in FMGE, and it has come in 2-3 years back to back. 2016 to 2018, this question was like one of the most trending questions of the exams. Which of them is better? McConkey is better or CLED is better? Single answer. McConkey is better or CLED is better. So the final take on that is CLED is better. If I have to select one, CLED is better. Now why? Why is CLED considered better over McConkey? They are doing the same work. They're telling me about the same lactose fermentation. Now, when that you'll understand only when you finally understand why are you using them. Tell me one classical scenario in which I will say put your sample in McConkey or put your sample in CLED. Which situation? You'll say, ma'am, when I'm dealing with a patient of urinary tract infection. When I'm dealing with urinary tract infection means I am going to get a urine sample. And which kind of organisms cause UTI? You say E. coli से UTI होता है. Common सोचते हैं. E. coli से होता है, Klebsiella से होता है, Proteus से होता है. So basically, I am dealing with all members of the same family. So I think like E. coli and Klebsiella are lactose fermenters. So I think I will put the urine sample either on a McConkey agar or I will be putting it on a CLED media. That is when I'll be using them. Either of the two. But I'm saying CLED is better. Why? Because UTI also happens because of other organisms, no? Like rarely UTI also happens because of Staph aureus. UTI can also happen because of Candida. There are rare causes also. Who supports the growth of rare organisms? Please remember, CLED allows other organisms also to grow. McConkey is a very, very restricted, very, very inhibitory kind of a medium. It says, okay, I will allow only these few important ones to grow. All these gram-positive wala I will not allow. All these gram-positive wala McConkey says I will not allow. But CLED is very, very liberal. CLED is very, very open. It even allows the gram-positive organisms like Staph or Candida to grow along with it. So if I ask you which is less inhibitory, you will say obviously CLED is the one which is less inhibitory. It allows more people, it accommodates more bacteria to grow. So it is going to be less inhibitory. So final answer, which is better out of McConkey and CLED? CLED is the better media, and that takes care of spotter 9. Spotter 10 and 11 come from the same set of things. So this is spotter 10 and this is spotter 11. You can answer one by one. You can let me know what is spotter 10. Which cell have I shown over here? Which cell is shown over here? Very characteristic cell. Perfect. Plasma cell. So क्या देखा? What all did you see that you called it a plasma cell? Let us draw it out. If I draw this, number one, I'll ask you, where is the nucleus? Nucleus कोने में है. It's at the periphery. The nucleus is not in the center. Or look at this cell also. You see now, nucleus is at the periphery. So basically we are dealing with an eccentric nucleus. We are dealing with an eccentric nucleus. After that, I'll say, okay, all of the cytoplasm is everywhere. Fine, let's shade the entire cell. But I will notice that around the nucleus, do you see a white area? Or over here, around the nucleus, there's a white area. Around the nucleus, there's a white area. So can I call this the perinuclear halo? Can I call this the perinuclear halo? So remember, number one, if I see an eccentric nucleus. Number two, if I see a perinuclear halo, all of you are right. This is a plasma cell. Correct answer. Perfect. Plasma cell. Antibody production karta hai. So eccentric nuclear, perinuclear halo. Coming to spotted 11. What is spotted 11, guys? What is this spotted 11 showing you? You will say, ma'am, firstly, it's a black and white photo. When it's a black and white photo, I'm dealing with what? I'm dealing with electron microscopy. So this is the electron microscopy of what? Okay, one answer, glomerulus, nahi. See, no one said that if I've given plasma cell once, I cannot give plasma cell the second time. This is also the picture of a plasma cell only. This is also a plasma cell. Only difference is now I've shown you the electron microscopic view. So if you look carefully, it's the same plasma cell. It's the same plasma cell. The nucleus is at the periphery. See, it's not in the center. The nucleus is still eccentric. And if you look carefully, the nucleus is showing you these lines like it's a wheel. It's showing you these lines inside as if you know it's a cartwheel. Because please remember, plasma cell shows you a cartwheel nucleus. Now all the 3 points of plasma cell are complete. All the 3 points are sorted. So let's do a recap. How does a plasma cell look like? Number one, it has an eccentric nucleus at one side. At one side. Number two, it is going to show you the cartwheel nucleus. And number three, it shows you a perinuclear halo or perinuclear off. I hope spotter 10 and 11 are sorted. Both of them were plasma cells. No bias, guys. Just because I've shown you plasma cell once doesn't mean I can't show you in the same class plasma cell again. So spotter 10 and 11 done. Let's move on to spotter 12. Answer. Spotter 12. It's a special stain. You can tell me the name of the stain. You can tell me the diagnosis. What stain has been used? And what is the diagnosis that you want to make? One answer that I've got is iron. Acha, sideroblast. Acha, first obviously I'll ring sideroblast. Or kuch? Acha, so what nicely you guys have thought is pearl stain. Okay. So I've got some right answers also, but first I want to rule out all the wrong answers. So for all of those who said that, ma'am, it's incorrect, but I'm taking it. All of those who said, ma'am, this is pearl stain. Pearl stain ka dusra naam kya hai? The other name for pearl stain is Prussian blue. Are we forgetting to see some color? Because I don't see a drop of blue color out here. Not a single drop of bluish color is very nicely seen out here. So I don't think it is pearls or Prussian blue. And if it is not pearls or Prussian blue, it cannot be a sideroblast. For all of those who thought it was a sideroblast, sidero is iron. If this is not Prussian blue, this is not a sideroblast. So that's not the correct answer. What I'm seeing over here, why did many of you call it ring? Because I agree it's looking like a ring. But if you look very, very carefully, this is pink color. P for pink and P for pass. And what kind of positivity are you getting? We are getting the dot blot or the block positivity. The block or the block positivity, which you see in a case of lymphoblast. These are all lymphoblasts. This is a case of ALL. Repeating, P for pass, P for pink, pass positivity, which is in the form of these dots and blocks, and they are all seen in lymphoblasts. I hope that's okay. Everyone who thought sideroblastic, basic yaad rakho, Prussian blue. I don't see any bluish color out here. So this can't be to do with iron. Coming to spotter 13. Spotter number 13. So first, okay, 13 and 14 actually. So this is spotter number 13. First let's deal with this. Then we'll go to spotter number 14. Okay. So what is your take? Acha, this is so easy. Ye kya hai? You'll say, ma'am, hair are coming out. All hair is coming out. So this is a classical case of hairy cell leukemia. Amazing. Hairy cell leukemia. Now first I want to ask you certain questions. 3, not all, but certain main questions. What will the blood profile or the blood counts of hairy cell leukemia be? How will the blood count of hairy cell leukemia come out as? Blood counts will be high, blood count will be low, or will they be normal? Hairy cell leukemia presents as low blood count. It presents as pancytopenia. Very good. It presents as pancytopenia. What do I mean by pancytopenia? Everything has gone down. Red blood cell, white blood cell, platelets, everything is gone. Full shutdown, pancytopenia. But there is one cell which is really gone down. Which is that cell? Specially, very good, specially monocytes. Especially monocytopenia is what is going to occur. So that is something that you guys have to know. So please remember, pancytopenia with monocytopenia is what is most important. Now imagine who is missing. Monocytes are missing. So which kind of infection will the patient have? When the monocytes are missing, MAC infection, atypical mycobacteria. Atypical mycobacteria is something which is very characteristic. That is how a clinical question comes. There will be a male patient, elderly male patient who will have pancytopenia with monocytopenia, and that person is having MAC infections. Okay. Having said that, spotter 13 done. What is spotter 14? Guys, what is your answer towards spotter 14? Which disease are we talking about? You'll say, ma'am, the same hair coming out. The same hair coming out. So this is again hairy cell leukemia. This is again hairy cell leukemia, but what's the difference? It's got no color. If you want to see hairy cell leukemia, now comes question 3. Which is the best microscope that you see hairy cell leukemia on? It is best seen on perfect phase contrast microscopy. So the microscope in front of you guys is a phase contrast microscope. The microscope in front of you is PC, phase contrast microscope. So that was the third question. You can see the hair coming out here also. My last question, what is the mutation? I think some of you answered that in between as well. All the cases, 100% cases of hairy cell leukemia show you which mutation. Let's write that on a separate slide. Everyone, let's make a table of that mutation also. Okay, so hairy cell leukemia shows us something called BRAF perfect V600E mutation. BRAF gene V600E mutation is seen in hairy cell leukemia and 5 other things. So you now have to tell me all those 5 things. One is hairy cell leukemia. So if you read it like this, it is hairy cell leukemia. If you read it opposite, it is LCH. What is LCH? Langerhans cell histiocytosis. So HCl, LCH, do ho gaye. What are the other 2? The other 2 is thyroid. Which thyroid tumor comes to your mind? Papillary carcinoma thyroid. Papillary carcinoma thyroid. And which brain tumor comes to your mind? And that is going to be pilocytic astrocytoma. Pilocytic astrocytoma. Now coming to 2 miscellaneous ones. One is melanoma and one is colon cancer. If you can remember them, then nothing like it. So repeating, LCH and HCl, PCT and pilocytic, melanoma and colon cancer. All of these are known to show the BRAF V600E mutation. So hairy cell leukemia definitely shows us BRAF mutation. Okay, spotter 14 done. Now let's come to spotter 15. This was one of the doubts that student had posted over Telegram. So I thought that I'll take it up directly in class. These two photos, what do they show you? Acha, before that, I think I have a question from Dr. Kirti. So I'm sorry to interrupt out here and take you back again. Dr. Kirti has a question that, ma'am, okay, these all show you a mutation on 600. I mean, just what is this? This is a kind of a point mutation. What do I mean by a point mutation? Point mutation means it's happening at one point. At what point? At codon 600. In the entire genome, everything is normal, only codon 600 has a problem. It's happening at one point, right? All of them show you a point mutation, but now that is where your Robbins 10th edition update comes. Is there any disease in which the BRAF gene, instead of showing you this 600 wala mutation, it will fuse with the KIA gene? BRAF gene and KIA gene are going to show you fusion. Please remember pilocytic astrocytoma. Juvenile pilocytic astrocytoma, more than this 600 wala mutation, it more commonly shows you the BRAF KIA fusion, and that is the Robbins 10th edition update. So I hope all of you are able to mark that also. So in case, ideally this question should not come, but just in case a question comes where they say in juvenile pilocytic astrocytoma, is BRAF KIA fusion more common or is the BRAF 600 mutation more common? So remember, now they are saying the BRAF KIA fusion is more common. Okay, having said that, let's get back. Spotter 15. Meanwhile, I saw many of you give me right answers. Now, I was expecting right answers. The reason why I got this question was, so obviously everyone's given me a right answer that Whipple's disease. Why am I discussing? Because there are some things we read in the textbook, but we don't apply those things. So I want you to apply that. Firstly, what have you read in the textbooks? You have read that microscopically, Whipple's disease will show you foam cells. Okay, and what is the stain for foam cells that you will put? You will say these are nothing but pass positive macrophages in the lamina propria. These two sentences are very nicely written in the textbook. I have to talk about them. So there are two pictures. The first picture is the usual picture of pathology. It's the, the typical pink and blue kind of picture that we have, the usual picture. So what I'll do, I'll try to take it up on a separate slide and zoom in for all of you so that you guys can see it in maximum magnification. So this is the, you'll say ma'am, pink and blue. Matlab ye jo hai, this is going to be the HNE stain, right? Now first identify this particular structure. Why did I call it intestine? What are these? These are nothing but the villi. These are nothing but the villi. After that, what are these cells? These khali cells, you'll say ma'am, goblet cells. Because this is the intestine, obviously we have to have goblet cells. Finally, if you see below, you see some light. They're not even dark pink, they're not even blue. They are a little whitish kind of cells. These whitish kind of cells are the foam cells. So for many of the students asking me, ma'am, foam cells kahan dikhta hai? Foam cells is seen on the regular microscopy. The regular HNE staining shows you the foam cells. If you want to confirm what these foam cells are, you will be putting a stain called P for pass, P for pink. Can you see all those foam cells? All those foam cells out here, they have all become pink in color. All those foam cells are becoming pink in color because you've used something called pass positive. So you will see pass positive macrophages in which layer? In the lamina propria. So some of you, when you see this picture, you're searching for pass. When you see this picture, you're searching for foam cells. You just need to be aware that when you're using HNE stain, that is when you will be seeing the foam cells. Whereas when you're using the pass stain, you will be seeing the pink color cells. I hope that confusion is sorted because both these things are seen in a case of Whipple's disease. Okay, spotter 15 seems to be done. Now let's go to spotter 16, which is actually a kind of an MCQ. One MCQ we can do, right? So this comes along with an MCQ, spotter 16. Please let me know the answer, guys. 43-year-old female presents with a palpable breast mass in the right breast and the consistency of the lump is soft and jelly-like. The FNSE is performed. First FNSE hua, then excision hua. FNSE is shown over here. Excision is shown over here. What is the likely diagnosis? And it's a common answer called colloid carcinoma. So first and foremost, when I'm dealing with, what all are you calling it? Number one, we are calling it breast cancer, colloid carcinoma. And there is something known as mucinous carcinoma. तो दोनों same है. Both of them are the same names. So what can I say? You'll say, ma'am, this tells me there's a lot of mucin, common sense, lot of jelly, lot of mucin. And that is why, look, my patient has a mass. The patient has a mass which is very soft and jelly-like. It is soft jelly-like. Why? Because this is a mucinous tumor. It has a lot of mucin. So the palpation will be very soft. When I do an FNSE of this lump, I see that these are all blood vessels. FNSE pe all blood vessels are, entangled. Now obviously everyone uses AirPods, but once upon a time, or still many people, I personally also like to use the earphones with the wire. So the way we've kept our earphones all throughout, all that entangled mass that we make out of it, same way. The blood vessels look like those earphones where the wire is all entangled and then we are trying to separate that out. Same way, the blood vessels are known as chicken wire blood vessels. It's a big entangled mass of chicken wire, right? When you look at this under the microscopy, that is by doing an excision, you will see that, ma'am, cells are this much. Then one tiny cell over here, one tiny cell here, one tiny cell here. But the background is all water. Because the background is having lots and lots of mucin. That is why we called it mucinous carcinoma. It has a lot of mucin. One very important question comes, where is the mucin? Is it out? Tell me guys, is it outside the cells or inside the cells? Where is the mucin? Extracellular or intracellular? So you are saying pools of mucin hai, ma'am. There are pools of mucin, ocean of mucin. But where? Extra or intra? So remember, extracellular. How will you remember this for the exam? Instead of learning it as mucinous carcinoma, I have learnt it as mucin out carcinoma. I have learnt this as mucin out carcinoma because that will always remind me that all the mucin is outside the cells. All the mucin is going to be extracellular. So that is why you are saying there are pools of mucin that are going to be present. So coming back, I think you could see the chicken wire blood vessels, you could see the pools of mucin. Classical case of mucinous or colloid carcinoma. Colloid is a misnomer. It has nothing to do with thyroid. Colloid is a total misnomer. Acha, so this was what? Spotter 16. Let's go to spotter 17. This has been quite an important question in the INI-CET, AIMS and JIPMER kind of papers. Spotter 17, guys. Okay, almost nearing the end. We had a plan of 20 spotters, so we are very close. Okay, so some of you are trying to reach somewhere close, but okay, some say schwannoma, some say type A, type B nahi dikh raha. This is all full of it. There's no type A, type B. Okay, let me draw something. Let me give you a hint. This is a soft tissue tumor. So at least you guys have reached up till there. If you're answering leiomyoma, schwannoma, you've at least come to the line of it. Finally, I've got a right answer from Dr. Ayan. That is Fibro Sarcoma. Guys, I'm going to draw a line. Tell me if it's making sense. That if I can draw an imaginary line over here, you'll say, ma'am, one axis is like this. And then we can see that cells are going perpendicular or they are going in this direction. Can everyone see the cells going? Can you now imagine that there's a line going and cells are going like this? What is this pattern known as? This is the herringbone pattern, and herringbone pattern is seen in a case of Fibro Sarcoma. I'm going to show you once without the labelings because this is the exact picture that will come in the paper. So you have to imagine a line going like this and cells are coming in these perpendicular lines to it. Herring is a fish. All the fish lovers would be knowing. Herring is a fish. तो fish का जो spine होता है, fish का spine, the bone, it looks exactly like this. So herring is a type of fish. So the bone of fish, that is how this fibrosarcoma looks like. Very, very important. Spotter number 17. Okay, spotter 18 is easy wala. One tough, one easy. Easiest one, just need to identify and we'll wrap it up. Nothing more that I want to teach you. Spotter 18, dumbbell shaped. What is this? Body. Tell me the answer and I'll go ahead. I don't wish to ask you any questions on this easy one. Okay, one answer I've got is ferruginous body. So all the intelligent students have called it thoda extra show of ferruginous body. And all the students who like to keep it simple, we've called it asbestos body. So yes, we can call it either. Either we call it a ferruginous body or we call it an asbestos body, means the same. The shape is very, very characteristic and that is the dumbbell shape. Very, very characteristic. Nothing more that I want to ask you. Okay, अब easy वाला हो गया, so tough वाला. Spotter 19. Last two guys, come on, give it your best. Spotter 19, some cell shown over here, some reference also shown over here. Some reference and a cell. Tell me the identification and the disease. Identification and the disease. Okay, so I'll tell you multiple myeloma, no. Multiple myeloma में तो plasma cells होंगे. I don't see any plasma cells. CDA, no. These are not erythroblasts. Okay, I'll give you a hint. This is a type of a megakaryocyte. This is a type of a megakaryocyte. So megakaryocyte, normally, if I draw a normal megakaryocyte, it will have multiple nuclei like this. That is how a megakaryocyte looks like. Now I'm saying I have a megakaryocyte which has 1, 2, 3 like this. 3 balls that you have over here. 1, 2, 3. This is known as a pawn ball megakaryocyte. What is the diagnosis? This is a pawn ball megakaryocyte, and in which disease do you see it? You see it in myelodysplastic syndrome. MDS, myelodysplastic syndrome, shows you pawn ball megakaryocytes. I hope that's okay with everyone. No confusion. All good. Now you'll say, ma'am, what is the reason for calling it pawn ball? Matlab, what are these three things telling you? So pawn ball is a shop which is very famous in UK, and it's also famous in India, but not by the name of pawn ball. So basically, it's like where you keep your items and your household items or your gold or your jewelry, and you get money in return. So that barter shop. That barter shop where you keep your personal belongings and they give you money on loan, that kind of a shop in UK especially, it has, how do you identify that shop from a distance, that okay, this is the shop where I can keep my gold and get some money? It will have these 3 balls hanging outside. So if you see this pawn ball sign, you know that it's a barter shop that they've put up over there. So the megakaryocyte has started looking exactly like that, and that is why they've called it a pawn ball megakaryocyte. Spotter 19 done. Spotter 20 is for our new kids. Ovarian specimen diagnosis. Last one for the day, then we'll call it a day, we'll call it a session. Spotter number 20. Ovarian specimen, and it has a classical fluid inside it. I'm ruining a lot of food items for you today. First I ruined shish kebab. Now obviously I'm ruining chocolate as well. So this is a chocolate cyst, and obviously in the ovary. So this is a chocolate cyst in the ovary. What does it signify? Chocolate to matlab basically the brown color. Basically the brown color, right? So brown color kya hai? Brown color is nothing but old blood. Let's think from human body point of view. We can't have chocolate, so we have old blood. Which condition has old blood? Perfect. That is the answer I was waiting for. This is a case of endometriosis. This is a case of endometriosis. So endometriosis of the ovary is because, endometriosis mein bleeding hota hai. It's about endometrium, right? So it has bleeding. Now in the ovary, if the blood is stuck, ovary is closed, right? So the blood is stuck inside it. So the blood will become old. So this basically, the chocolate color is only because the blood has become old and oxidized. So it is old blood. That is why we call it the chocolate cyst. with which we obviously finished the 20 spotters that we had planned for the day. And I guess it's been a very good session, at least for me, because I did not have to do much work. I got some amazing answers, so the session for me became very, very smooth to conduct, and I hope you guys have also found it beneficial. Okay, Dr. Vanessa, thank you so much for the appreciation, and genuinely it means a lot. And Acha, spotter 18 is having a little bit of a problem related to Verruca bodies. No, Verruca bodies will have palisading. This does not show you palisading. There is no palisading seen over here. So not happening. Okay. And Dr. Gunjan, classes, special classes that you're asking about, there's no set, what can I say, a set ritual as of now, or there's no kickstart morning kind of ritual going on at present. That will start in the due course of time, as I have promised to everyone. But as of now, we are having random off and on classes. So last week also we had 3 sessions. Today we had a YouTube. In the coming 3 days also, we are going to have 1 or 2 more classes. So off and on sessions are being conducted. You can just keep following the Telegram group, because I keep posting about the classes and the notifications there. So you can obviously follow it up from there. Okay, next, what are we expected to know about platelet chapter for NEET and INI-CET? Two very different questions. See, if you ask me for platelet chapter in NEET may they are more interested in the diseases. Like they'll be interested in Bernard-Soulier syndrome, Glanzmann thrombocythemia, ITP, disease, clinical question disease. Whereas if you're talking about INI-CET, they really like asking you techniques, laboratory tests. Like they will really like to ask you thromboelastography. They will really like to ask you platelet aggregometry, and these are classes that I have conducted on Unacademy. If you see the Kickstart morning session, TEG has been a class. In fact, it came in the recent exam only. Platelet aggregometry, their graph. So INI-CET is more interested in laboratory tests. NEET is more interested in the diseases and clinical scenarios. Okay, so thank you, Dr. Mustafa, again, and I think it's always a pleasure that to meet all of you. Thank you, Dr. Dhruv, also, because I think I don't know how much of motivation I can give to you guys, but the amount of appreciation and motivation that I get from you guys, I sometimes feel that I might not be giving you that much as I am getting in return. So genuinely a heartfelt thank you, and I mean really kind of you to say all those nice and kind words. Everyone likes appreciation. I just hope that I am able to give back the same motivation to you guys also, and that sluggishness that comes in our day-to-day routine. I hope the classes can break that and you can get back on track. So thank you so much. And yes, I'll be meeting you guys tomorrow also. Tomorrow as well, we'll be having another session. I'll update the timing also by morning, so that we all have the link and time ready. Till then, keep studying, and thank you so much. Good night. I'll be meeting you all.